So, today I want to talk about pharmacies and religious exemptions. It should be fairly evident at this point that Christian nationalists have used the legal structure of the United States government to attack reproductive health care. With the overturn of Roe and many states pushing for bans or restrictions on contraception, in addition to Clarence Thomas's opinion in the recent Dobbs decision, we can clearly see state violence being enacted against people trying to make sound and rational decisions for themselves and their health care. That said, this state level violence seems to have emboldened some individuals, and perhaps made more visible a form of social violence that seems to be occurring far too often, namely the denial of services to those seeking reproductive health care products on religious grounds. So let's take a look at a few examples of what I'm talking about. So, in this first case that I want to discuss, imagine that you're walking into a pharmacy and you walk up through the aisles and you try to pick up a box of condoms to purchase, and you walk up to the cashier and place it on the counter. And then the cashier says to you, "Oh, I can't sell those to you." Well, this is exactly what happened to a woman in Wisconsin who simply tried to purchase a box of condoms for use with her and her husband. And this is exactly what happened. "Oh, I can't sell those to you," she remembers a clerk named John telling her as she stepped up to the register with her purchases. Obviously, she was confused in this moment. She thought maybe he misunderstood. "Well, we can sell those to you," he clarified, "but I will not because of my faith." Now, I just want to say, I don't know what religion bars people from selling latex to a customer in a store, but we all know that this is really tied to this type of Christian nationalism and Christian fundamentalism that is constantly fueling these kind of absurd behaviors. I told him, "That's none of your business," she said. He said, "Well, I'm sorry, this is what my faith demands." "You're not sorry," she remembers telling him as a line of customers backed up behind her. "I was the only woman in the store at the time," she said. "It was a very lonely moment." And that indeed can be an extremely lonely and scary moment when you're the only person of a certain group that's being targeted in a store. And I need to address the reality and possibility that this cashier did all of this and made all of this a spectacle, knowing full well that she was, in fact, the only woman in the store. While I can't prove what was going on in his head, I have to wonder if he would have pulled the same tactic had a man tried to buy those condoms instead. Further, given that she was in fact the only woman in the store, I do wonder if he was trying to shame her or embarrass her and make her uncomfortable enough to leave without the product. Now, when Walgreens was talked to about this, when they were asked for comment, Walgreens had responded, "Our company policy allows team members to step away from completing a transaction to which they have a moral objection and refer the transaction to a fellow team member or manager who will complete the customer's request." Now, I have to call this policy into question, especially when we look at the next two examples, so keep this policy in mind when we're looking at those. However, even if all of this was true, for as much nonsense as it all is that you can simply decide that latex isn't something you can sell somebody, all the cashier had to do in this instance is call the manager over and leave it completely discreet. They didn't need to go and make a show about it and hold up the line and everything else. They simply could have called the manager and handled it in a more discreet fashion. Furthermore, I have to wonder if Walgreens ensures that at least one person in their store can in fact sell these products at all times. What if you have a situation where people call out or you don't have enough people working in the store, especially near the end of a shift, and all of a sudden they decide, "Oh, we can't sell this to you and you can't buy the product that you need." That's an absurd response to all of this. Now, it is also worth noting that someone actually did demonstrate that her story was exactly as it was stated. According to someone else, she was being very respectful in her discourse, said this person who reached out to the couple on Twitter. She was just asserting, "It's none of your business. I'm purchasing this. Your beliefs shouldn't impact what I do." And the guy was pushing back against that. And the fact that this is collaborated and that this guy is flat out saying that the cashier was pushing back means that this was not just an attempt to, push this to the side or say, "Oh, well, I don't want to sell this to you." They were making a very obvious spectacle of this circumstance. Now, the person that this happened to actually was concerned of how much more humiliating the experience would have been for a younger, less self-assured customer. She wonders if the clerk would have said anything if her husband had been the one to approach the counter with a box of condoms in hand. And it's this kind of moment where you have to wonder about bigotry and, in this case, sexism, but bigotry of all kinds, where you really have to consider whether or not you're being specifically targeted for something like your gender in these moments. And, being the only one targeted by this type of situation can be extremely embarrassing. And a younger person with less experience may have actually been shamed or ridiculed by this situation. Bigotry, whether it be racism, sexism, homophobia, transphobia, ableism, or any other similar experience, can be humiliating. And to have to deal with that and then have to have the confidence to be able to step up and stand up against it is extremely difficult, and nobody should actually have to deal with that. Meanwhile, in the next instance that I want to go over, we have a situation where a young woman named Abigail Martin went on TikTok to explain that she had been taking oral contraceptives for 6 years and was actually due for one of the remaining 4 refills on her prescription. She described the encounter. "When I told her what I was there for, my birth control, she looks me up and down and goes, 'Okay, excuse me.' She then says, 'Yeah, we're not going to refill that prescription. You need to call your provider.' And I said, 'You won't refill it or you can't refill it.' And she goes, 'You just need to call your provider.' So, assuming that there was no real issue, she calls her provider, who then reconfirms the prescription to Walgreens. Later on, now a week later, she's able to contact the pharmacy and speak to someone else, who then says her prescription should have been filled before confirming the denial of service had become a problem in the store in recent weeks when it has come to contraceptive use, especially female contraceptive use. Now, I feel the need to point out the type of damage that this can do to the body. Birth control relies on hormones and adjusting the hormones in the body. So this ordeal being extended over a week meant that this person didn't get hormones that were consistently being pumped into their body, which means their hormones literally got messed up, in addition to their birth control regimen becoming effectively ineffective for a certain period of time until they take it consistently again. And because of that, because of these circumstances, someone with a power trip decided that people didn't deserve to get birth control, and thus this person's life was affected. Birth control pills also are not just for birth control. There are a number of reasons why many people take it, and it's absurd that this pharmacist felt bold enough to do this in this moment in time. Now, the next thing that I want to look at is a case that happened in Louisiana, where a Louisiana doctor prescribed a medication called Cytotec to make the insertion of an IUD less painful. The medication has several uses and is often prescribed for stomach ulcers. A lot of people might know it by its brand name, misoprostol, and it is part of the 2-cocktail drug regimen that is used to terminate a pregnancy. Well, Walgreens called the physician and asked if the prescription was for an abortion, according to an affidavit filed on July 5th. Now, when she had told them that it was for an IUD insertion, the pharmacist still refused to give the medication. Now, Walgreens did not respond to the question about whether the medication was denied, but said in a statement that they were prepared to adhere to new laws and that any prescription medications, including pregnancy-ending medications, are dispensed in compliance with applicable laws, meaning that Walgreens and a lot of these pharmacies are going to follow the letter of the law when it comes to, making sure that people can't get access. But when it comes to denying people, which is, of course, a problem and is actually federally illegal, they have no problem allowing people in their store to deny services. And even though their policy officially might state, oh, you have to get someone else to fulfill this prescription, the fact remains that for several people, this is not happening. And if this is happening in these very vocal situations where people are talking about it, there's a good chance it's happening to a number of other people that aren't being as vocal about this. Now, as much as I'd like to pretend that this is something new and that this is only happening because of the overturn of Roe, these situations have actually been occurring for a while. And make no mistake, the majority of these instances, like I said, are unlikely to be reported. However, we can look back at an instance that happened in 2018, where an Arizona woman has criticized Walgreens on social media, saying a pharmacist at the chain refused to fill her prescription for a medicine prescribed to induce miscarriage after she was told her 9-week-old fetus had stopped developing. So, the reason that you would even induce a miscarriage in this circumstance is so that you can get along with your everyday life. If the fetus has stopped developing, then it's effectively, just waiting for the miscarriage to happen. So you speed up the process. Now, the person describes their situation. Again, this is back in 2018. Last night, I went to pick up my medication at the local Walgreens, only to be denied the prescription I need. I stood at the mercy of this pharmacist explaining my situation in front of my 7-year-old and 5 customers standing behind, only to be denied because of his ethical beliefs. And in another instance, we had a woman who said that 2 local pharmacies had refused to sell her a morning after pill when she needed it, and is now filing suit against the drugstores. The pharmacist had responded at Thrifty White, the only pharmacy in her town, that I don't feel comfortable, that goes against what I believe, and all of a sudden it clicked, and I said, "What?" she said. She then tried to go to a local CVS, where she was again turned away. Finally, in an ironic twist from what we've seen from Walgreens, this person had to travel 50 miles to go to a Walgreens through a snowstorm in this moment and in this instance in order to get the medicine that she needed, in order to ensure that she did not get pregnant. And this is the kind of ridiculousness and absurdity that we're talking about and seeing, and these are just examples that we've come across. These are just small examples, but these stories exist everywhere. And I do want to emphasize that while I have only shown a few examples of this, it needs to be remembered that there are a lot of personal stories out there that collaborate with that these type of events are in fact occurring. I know that anecdotes don't tend to work on a lot of people, which is unfortunate because we should be believed about our experiences and what we go through. However, it is anecdotes that make up the bulk of data. How many times does this need to happen before it's accepted as something worth researching, looking into, and developing research for in order to back up all of these anecdotal situations? Whether it be people in your lives, ask them the type of questions of if they've ever experienced anything like this. Look at Twitter and look at the examples that so many people have brought forward, especially in response to these. These articles actually have links to Twitter threads that have tons of people talking about their experiences. And one that I think is worth noting is that a woman went in and was denied until her husband phoned into the store and threatened to sue. And it's like, you have to adhere to a man to come in to provide women access to these services that they need. And, while Walgreens seems to be one of the worst offenders, as I showed, there have been similar experiences in other pharmacies, whether they be local pharmacies, Rite Aids, CVS's, or other national brands. Others have reported that this extended to other medications. Other people have experienced this with their own medication needs. This includes trans individuals being denied access to hormones, even though it's been prescribed by a doctor. It includes neurodivergent people being denied their medications. And it also includes some people not being able to get the type of prescription that they need. Sometimes generics don't work, and some of these pharmacies will instantly go to generics, even though the prescription flat out says that you're not able to. And while I can't attest to it working, I've seen a number of people online claim that what you have to do in these moments is flat out say to the pharmacist, I need to submit a complaint about pharmacist refusal. Apparently, this does the trick in a number of situations, and it may get your situation rectified if you ever find yourself in this exact circumstance. The fact remains that while it remains illegal to do this, some people are using their positions of trust and power to inflict harm onto people. Denying people condoms and birth control, or even just making a spectacle of the purchase of reproductive health care items, is something that nobody should have to go through, and especially when it comes to women, trans individuals, of all backgrounds, and the types of situations that we see. These are not circumstances that we should have to go through in order for people to get the care that they need. There's no reason that anybody who is capable of becoming pregnant, who is a birthing individual, should be denied the health care that they need because someone with a power trip and a religious excuse decides that they do not deserve to have access to them. People's access to these things need to be protected. So with that said, if you've enjoyed what you've watched, consider liking the video, subscribing, and leaving a comment, as well as joining my Discord where we have conversations about topics like these. If you are in a financial place to do so, and only if you're in a financial place to do so, please do consider supporting me on Patreon, especially as political content like this can often be demonetized on YouTube. The links for everything that I mentioned are in the description down below. With that said, my name is Anarchist Tara. Thank you so much for watching.